Philippa Whitford.
Thank you very much, Mr Deputy Speaker. Obviously, the bill itself is quite a small bill. It doesn't extend or protect continuing reciprocal healthcare rights. It is simply an enabling bill to try and give those powers to the Secretary of State to try and do that. It enables him to pay for overseas treatment in the EEA in Switzerland, and obviously we've heard how the Lords have removed the powers to extend this on a worldwide basis and increase the scope, along with limiting some of the Henry VIII powers. It also will allow him and his team to negotiate healthcare agreements with the EEA and Switzerland as a group through the EU system, or, failing that, bilateral agreements. Now, unfortunately, that then would mean individual bilateral agreements with 31 other countries. That's inevitably going to be more complex, more bureaucratic and more expensive. Clause 4 allows data exchange, which I can say most members would recognise is absolutely critical, not just from the point of view of collecting payments or swapping the money, but actually accessing medical health records if someone is going for treatment to another country. And I think it is really important that this will only be handled by an authorised person who is part of a statutory body, a public body. I welcome new Clause 5, which says that the devolved governments must be consulted as this goes forward, as of course it is the 3 devolved governments who deliver healthcare within Wales, Northern Ireland and Scotland, and it's absolutely critical that they are involved in any agreements. This legislation is needed whether there's a deal or no deal. As came out of the earlier point of order exchange, the withdrawal agreement would extend through transition, but we've all seen how the last 3 years have melted away like snow off a dike, so the next 20 months would also disappear, and therefore legislation is required for the long-term protection of those who already live in Europe or want to stay in Europe, and particularly those who may only have been there for a few years and do not have 5 years' worth of residency rights in the country they have chosen to settle in. After this, it is therefore important that the government will hope to negotiate continuation of reciprocal healthcare. The problem is reciprocal healthcare was not a freestanding thing on its own. It's simply to enable freedom of movement. You can't exercise your freedom of movement rights if you simply can't afford healthcare where you choose to live, or work, or love, or settle, or retire. And we've had those rights over the last few decades to retire and settle anywhere. People are well aware of my husband's situation as a German citizen who lives here and has actually spent virtually all of his adult life working in our health system. And that was certainly his first concern after the Brexit vote, and I'm sure is a concern for all 5 million people who are either settled here from Europe or settled in Europe from the UK. The problem is, as the government rejects freedom of movement and talks merely about a mobility framework, what is described in the impact assessments is that any reciprocal arrangement is likely to be proportional to that mobility framework. The government is not offering visas over a year for unskilled workers. It is demanding that people should be high-skilled and earn possibly over $30,000 a year, that they should be economically active and contributors. So will pensioners actually still be able to retire somewhere else? Because they're not necessarily contributors in a major sense, and they're certainly not necessarily economically active. Now, people highlight the difference between what the UK has to pay into the European system and what they get back from the European system. But a lot of that is quite simply because of the number of UK pensioners who choose to retire to sunnier climes, and who can blame them? And the general lack of obsession with retiring to the drizzle of wanting to come in the other direction. And living in Scotland, I can vouch for that. Who would choose to leave the south of France and come and live in mist and fog and drizzle? That's the reason. That's the reason. Well, maybe. That is why the numbers of European pensioners retiring to the UK is considerably smaller than the number who have retired to the south of Spain and the south of France. And I think that's just simple logic. I give way.
Exactly. Speak for England.
Would she account for the massive diaspora of Scots all around the world, as giving their comment on the mist and greyness of the Scottish location? Why do you think so many Scots live abroad?
Well, I think the honourable gentleman wouldn't maybe like me to get into the issue of the clearances in the 17th and 18th century when people were burnt out of their villages and put on boats or were transported for criminal activities. There's all sorts of reasons why Scots have ended all over the world, and they're not because of weather. Oh, well.
I adore Scotland. I just love the mist, the fog, the rain. It's what I call proper weather, and it's to be celebrated.
And that's why I live there, right beside the sea. But that doesn't necessarily mean, if you were living in the vineyards of France, that you would go, oh, you know what, the weather's a bit boring here. I fancy somewhere with snow, sleet, hail and sunshine all in one day. But it is still the fact that it is disparate because of the number of pensioners. And it is often described as if it's somehow the EU tricking the UK. It simply isn't. We are obliged to pay for the pensioners from the UK who have settled in Europe. And indeed, we pay a fixed rate per head, which is considerably less. Indeed, it's only just over half what would be charged on the basis of a European citizen settling here. I give it.
I'm most grateful for giving way. Would she agree that another reason is perhaps the NHS is being free at the point of need has not been over the years as geared up for recording the patient episodes of EU nationals as other countries are, or indeed of collecting that kind of data, because it is not an insurance-based system. It's a system which is free at the point of delivery and therefore doesn't necessarily have the mindset or the paperwork to think about money in terms of healthcare.
I totally agree. That's absolutely part of it. And the government have to consider, for the numbers involved, is creating that entire administrative system going to actually bring more money back in than is spent on administering it. And I think it's also very important to consider, as we go forward into things like settled status, exactly how will doctors and other health staff be expected to demand to see someone's settled status? Is it based on a foreign-sounding name, or a skin colour, or an accent? Because are you going to have to produce an ID card if you were born and grew up here and have never been anywhere else, and you are, 20 generations English? Because that's the thing. There is no ID card here. In other European countries, there'll be an ID card, and there will be the ID card showing UK citizens having whatever their equivalent of settled status is. We don't. So I think that doctors and others are actually quite anxious about on what circumstances do they ask for proof of habitual residency. We're seeing it already around universal credit. I have a lady, a German lady, who's been settled here for 30 years and was refused universal credit on the basis that she was not habitually resident. So we're already seeing these things, and we don't want to see them around healthcare. As has been mentioned, there's the three main groups, almost 200,000 pensioners, which is the biggest group, using their S1 rights to register somewhere where they have never paid tax and yet benefit as if they have. So the important things are continuing their rights, or they may end up having to come back home. And they will cost more here than the government is actually paying France or Spain to deliver their health care. It's important that they're not limited in some way, that only people who do not have medical health risks would be accepted in the same fashion as happens with insurance. And certainly for ordinary pensioners who have exercised those rights, they would simply not be able to afford comprehensive private health insurance. Now, there is a lot of work being done to protect those already settled. But what about the rest of us who might have fancied settling in the south of France or Spain? Is this something that's actually going to be achievable or reachable by ordinary pensioners in the future? There's approximately 1,300 UK citizens who use the S2 forms for planned treatment, and the biggest number, 250,000 claims a year through the EHIC card, which allows people to travel or study all over the EU. And as the member for Burnley said, that even includes people with expensive chronic conditions requiring treatment such as dialysis 3 times a week. And I defy any member to find a health insurance that would be affordable, that would cover something like that, because that is not a risk of health care, that is a planned health care, or else the trip simply can't be made. As I mentioned earlier, this should not be extrapolated to EU citizens who are living here or UK citizens living and working in Europe. If they are already paying full tax and national insurance here or the equivalent in Europe, then they qualify through those payments and those countries are not being reimbursed by the UK at the moment. The Withdrawal Agreement Bill only covers transition. It does not go beyond that. And the problem, of course, is that if there is a no deal, which is still hovering over our heads, then that could come very quickly. It is important, therefore, that the government do negotiate, but that they recognise that it may well be on a much more limited basis. Reciprocal healthcare was not designed around a stag weekend in Prague. It was literally to facilitate freedom of movement. And to me, this bill highlights what we're losing with Brexit. We're losing freedom of movement, which has been described often from the dispatch box as something negative and that the end of it should be celebrated. It's actually one of the greatest benefits we as individual citizens have had from being in the European Union. And it works both ways. We all know people who have worked or studied, have met people from Europe, have settled there, or their partners have settled here. It has been a great contributor to friendship and love across Europe. And the problem is you can't exercise those rights unless you can afford healthcare. So to me, sadly, while we will not be voting against this, it is necessary, it is work that needs to get done, it still makes me sad because all it does is highlight what we're losing.